Hello, and thank you for joining me. This is Push and Pull, a medical massage podcast. I'm your host, Justin, LMT, and co-owner of Touch of Phoenix Elite Massage. This show is brought to you by the Tall and Short of It Productions. Hope you're doing well. This episode is going to be maybe thoughts on some clients that I had recently, some issues that came up, in the way that I approach the session. Although I guess there is a happy ending at the end of it. So I was presented with, let's say, the flash. The flash came in. I don't think the symptoms are all that important. Overall, I mean, I'll talk about them, but I don't want to be super specific. Because I guess the moral of today's episode is talking about putting clients in a box, and maybe even putting your own practice into a box, which can lead to the inability to see a solution, even though you've been presented with the answer, something similar. So I'll use two clients to illustrate this point, where I was presented with knowing the area, or being familiar with the muscle that was damaged, being familiar with protocols that have helped it in the past for other clients. Although I guess the caveat for these clients in particular, and what spurred this episode, is the fact that they were or are serious athletes, and that difference in muscle density and pressure needs and goals were all different. And when first presented with these clients, it's obvious right away, but I guess the idea is that you have to, I felt like I had to ask a lot of questions to get to maybe where they wanted to be with the session. So, having said all of that, to set it up very generally, I know that doesn't make a whole lot of sense, but where we're going with it is that the first session was kind of bollocks. It was not what she wanted, but interestingly enough, there was an element of she wanted to reschedule as well. So what went wrong, what went right? And this is where we can kind of dive into some things. So the first thing that went wrong was the wanting to use techniques that work with other clients with them. And what that means is I tend to need less pressure and just more precision with the clients that I see usually, in the sense that they're older in age, and the injuries are of a degree where their bodies are not built and strong. You would just say they just live an average life. No, I would say low intensity, not energy levels, but activity levels, to where the muscles aren't used to being worked. So when you work them just a little bit, they tire out and do their thing and release and relax and let you, really get good massage work done. So the first mistake was assuming that this was going to be, similar to that, in the sense that, these small motions, gentle motions, not going too fast, and all this stuff that works for another population of clients, it was not working for her. So in my awareness of this and trying to do better in the moment, I ended up then like moving too quickly to where these muscles that are really used to like being worked, put under pressure, past the break, like brought past the breaking point to then be built stronger. They were used to that type of work, and I was not able to work them well enough. So in noticing this, I was like, well, if I'm not working them enough, maybe it's not in this area, right? Maybe I'm working the wrong muscles. So, bad self-talk going on during the massage, trying to find the right answers. And it brought with it this sense of like not completing a good massage. I was basically just like figuring out what needed to be done in the moment. Even having asked good questions, spending a good amount of time prior. We started with stretching just to make sure she would be, make sure the muscles in the areas that we were working were open. We talked about even like, we want to do it like in a sports fashion. So it was, not with like the sheets and this and that. We just had her on the secondary table, just clothes on, and just worked like in a sports manner, stretching and things like this. But what we found was the way that we were working was not complete enough. We were working too many areas too quickly with not enough pressure, and leading to like I don't feel any results. And that's a really rough place to be. I don't think you want people paying for your services and like not getting the results that they expected. So with that being presented in the moment, we talked about it and did whatever had to be done to make it whole. I'm not worried about the back end of things. I'm more worried about how you handle that with the client. So we talked about it. I said that I wasn't too happy with the session as well. That her concerns were shared by me, and that it was it's understood that we didn't get the right thing done. So with that being said, you have to figure like, all right, so she sees the, what would you say, maybe like the intimations, the glimmers of you like knowing what has to be done and what you want to do, but now you have to capitalize on that. How do you effectively take the same problem and work it differently if you didn't have the right answer beforehand, right? So that's where like the awareness and all of that matters, where you're talking to the client and noting their reactions or non-reactions. In this case, when we were doing various stretches, pin and stretch, you move this, I move that, stretch this, press here, move there, doing all this kind of stuff. So like no results. So needless to say, I was pretty flustered, but there was, like I said, she had this glimmer of I may have had an understanding of how to solve the problem, so she wanted to reschedule. And that's an interesting thing. So here's someone who trusts the knowledge more than the process, but sees the process as something that was like useful to both her and me. The term used was consultation, which again, this goes back to the idea of like putting things in boxes. I hadn't even thought that anything that I did was even remotely close to a consultation. You think you're like hitting the nail on the head all the time. And it definitely was not in that case. So we had to take that as like significant criticism in the moment and say like, okay, well, we gotta totally rethink the protocol, totally rethink the plan then, and see what we can do differently. So the main issue was assuming that anything that I've done previously would have prepared me for that. Obviously, I had been like presented with these ideas before, but not in a way that I had been able to make them part of like my practice and had like incorporated them, you would say. Just adjusting my microphone here. I realized I was clipping it a little bit, didn't want to be too loud, but the bottom line is you're going to be presented with the same issue that you didn't know how to work previously. So you have to go back to the drawing boards, right? You have to think, okay, what didn't work? What caused me to freeze up? What were the problems presented in the moment? And just like totally retool the thing. I had 1 week to totally retool the thing. So what we ended up doing is thinking about body mechanics, thinking about pressure, thinking about leverage, thinking about terms that she had used to describe qualities of pain and symptoms and when and what a squat is, and all of these things I had to think about to try and gain an understanding of how to work on an athlete body where they will and have put their body through more than I can on a table, where previously I just wasn't used to that, in the sense of anything that I was going to do was going to be more than these individuals had done with their own bodies previously. That's an interesting concept, one that I didn't understand until after she had really walked out of the room. I'm often very impressed or surprised or taken aback, maybe even like enamored with the athlete muscle tone, the strength of the fibers, the way it feels like a cable almost. It's like very intimidating. Intimidating in a way that like they have to be worked differently. One of the things that like really sticks out, I try to use the term gently before asking a client like to move something, just because a twitch reaction can throw off the exercise. So you want them to activate slowly, so you can even like feel if you're in the right place. If you want them to activate, if you want them to activate X, you don't want them to, and you have pressure on it, right? You don't want them to, wing something and actually like overexert and hurt themselves. So there's an element to which, like, if they just kind of think about moving it and make sure you're in the right place, like that, you want them to move pec, they initiate a motion, you feel like, oh, I don't feel like pec moving. You're probably in the wrong place. Have them relax, move to where you think you're, in a better spot or whatever. So it helps you find what you want to be on. If you talked about motion and when it comes and where it goes and blah, blah, blah. So you want to make sure you're in the right place, and then B, that they're not like throwing you off. And I often think about the like electric bull effect of them activating a muscle too fast. Like you literally just roll straight off of it. And that was an issue that I was running into a decent bit. I wasn't able to communicate how much I needed her to be careful, and take it slow. And again, that was a big like miscommunication on my part, where I figured it out after after one or two times, but those 1 or 2 times are enough to shake faith, maybe even make the problem a little bit worse than when they had come in previously. So there's an idea to which, like, you want to be precise. You're not, the time for practice is before. And I had limited practice working with these athletes. And to the degree that, like I said, what felt like a session of what felt like a session that would have been exactly what somebody else needed, it was like not even close. It was barely even like a toe in the water for her. So that was really tough. And then we were presented with another client after this who was kind of similar. And we hoped that we were able to take what we had learned from this flash client and and apply it here, because when she presented, she was very obviously coming from a lot of exercise, a lot of activity, lifting, to where, again, I fear that I'm not able to hit the pressure point, the pressure thresholds that these clients need, because they just put their body through so much more than I can. And I say can, not that I don't know how, but one of the limiting factors, and this was present in both of these clients and in some of the other clients and sessions that I have, is the difficulty with gaining leverage and working deep enough that you get palliative pressure subjectively, and then objectively getting good results. Thinking about subjective and objective. Subjective is like what the client feels, what they say, the words that they use, like facial movements, twitches, rearing away from you, leaning in. All of these are like subjective markers of what something feels like to them, and then objective is like you as the practitioner, like feeling something relax. And these are stuff like you talk about in your notes and whatever. But where I was going is getting palliative pressure subjectively, to where the client says like, yeah, that's where we want to be, that feels okay. And then objectively, it's not too much where you can feel them, and it's not light enough that they're just like, whatever. So they are way on, the need more pressure end, and in the sensitive areas that we were working in, it's tough to get that kind of pressure. And this brings me to one of the other mistakes that I was making. So like, pressure concerns are, they're up to, conversation, I think. Depending on what's going on with somebody, there are definite scenarios where the therapist's discretion is better than like what the client is saying. There's a world where I think sometimes the therapist just knows better. It may not be safe to press in particular areas. So that's often a concern, but I don't think this was not one of them. It was we're working anteriorly on the abs and trying to get to the psoas muscle, the iliacus muscle, sitting along the inside of the pelvis wall and anteriorly, trying to hit these like sensitive areas, just like interpersonally, and then just sensitive, like there's kind of a lot of like fleshy bits and like fat and stuff, and like organs and all sorts of stuff in between you and the psoas muscle that lies deep to the spine, the lower thoracic and then lumbar vertebrae. Forgive any like A&P, bad A&P descriptions, but what I'm getting at is like, we want to be able to sink deep to those muscles, but we also want to work in a way that's like not like going to kill her or me. And what we were finding was I was not able to do that, because I was still working in this like hit every area of the muscle belly, and every time I moved I wanted to come completely out, and we worked with breath and in and out. And what you end up finding is like that just like was not good enough. What we needed is like deep pressure on those muscles and stay there, and then have her slowly engage and move and stretch and press, where we were just doing it so erratically and so quickly, and trying to get a sense of like how this felt, how that felt, where we go, like what's next, do we flip you over, can we move here, is this comfortable, what's the propping like. So there were just so many factors that led to just like her not getting her not getting a good massage, but getting like a fine consultation. And like, what a weird concept, right? Because in my head she had came in for a massage, and in her mind she had came in for a massage as well. So again, that's like the clinker that we were dealing with, and these were all the issues that were going on during the session. And it's surprising to think, like, you know, how does someone describing an issue like this ever get results? But yeah, it was super, I might say, embarrassing. I was definitely like in my head about it. I felt very defeated about it, obviously. But there's a world where I think I was able to come back a little bit stronger, because the next time we saw this client, we took heed of everything that we had talked about. So pressure concerns, area concerns, speed concerns, all of this stuff. We had taken it all into consideration, and I had altered the protocol, the session, what it was going to look like, to pretty much a complete degree, to where the session that she got the second time around was totally different than the first, taking everything into consideration, as I'd said. So we were able to perform in a way that showed glaring mistakes, but also in a way that made her believe that with a little bit of practice I could do better. So, excuse me. So that's a interesting area to be in. So when she came back, we were able to get much better results the second time around. Now, the insight of the speed only comes after the second time. So we slowed down, we're able to increase pressure, work more in the areas that she needed. Although the one complaint, or just the one note of the second time, was that I was working too laterally, and the issue is very medial. And that was a note that I didn't ask any questions that was an answer that wouldn't have been brought out of her previously. So going into session number 3, we want to keep that in mind and work very medially to the psoas muscle. The hips don't seem like as much of a concern to her. The pain that's going on is, like she said, very deep and medial. So we definitely want to think about that. And also, we need to think about the ways to just keep pressure on the muscle belly that you want to be working, and keeping leverage and body mechanics healthy in a way that, like, you're not doing damage to them, where it's not like super uncomfortable, where you're like shifting pressure all the time, because you have to maintain an even pressure, or, you know, even reduce at a steady rate, or increase at a steady rate. You don't want to be up and down and up and down. That's going to feel like you're like stabbing somebody. So we want to keep that in mind for the next session. But there's all these things that were ideas presented in massage. They weren't ever things I had to think about too much, in the sense that the athletes that I had been presented with previously were, their main treatment was another practitioner, and I was supplementary, in the sense that I wasn't the main healing factor. So while I would have been a part of success with athletes, I don't think I ever truly understood what went into the actual pressure needs of an athlete, and truly the leverage that you have to be able to get the work done and the stretch done that the athlete is able to do themselves. So there's a world where thinking about body mechanics is super important, and making sure that you're stable and safe while getting them the palliative pressure and working in like the proper area, the right area, working on the muscle that is like effectively damaged. So that was the kind of summary of the sessions with the Flash, we'll say, and it was illuminating. It was mind-numbing in the amount of like negative self-talk that came out of it. I was so hard on myself for like wasting her time, effectively wasting kind of not wasting my time, but like I've got such an ego about me, man. I think so highly of myself in like I don't know, like maybe not like an inflated way, but my successes with clients are of the kind that I felt like they were totally ours, totally organic, out of grown and born out of the therapeutic relationship that we developed like from moment one together. And those are the clients that I think of most, and I think like, what would you say, like not cherish most, but like value highest, just because they mean the most in terms of like progression and learning and like getting better, right? So with that in mind, you would say, excuse me, all these yawns. You would say, I think I am pretty full of myself in that sense. So when you're presented with clients that you've like worked totally improperly on, it is just mind-bendingly just like devastating. I have not been that defeated by a client in a long time, but like I said, the silver lining, the happy ending, is she saw that in some way and thought like, well, this is the guy that's going to fix me. He just has to figure out how. And that's a fascinating idea in the sense of like, there are problems I'm presented with that I just need to gather the information, and then it turns out to be X, and then okay, you just like proceed as normal. So like you already know the answer, you just have to like compile the data to arrive at that answer in some way. But this was truly like, how do you know as a client that somebody has the answer? Or has the ability to attain the answer, they just don't have it yet. That is a weird place to be, and I don't know if I myself am that trusting. I don't know if I would have taken that same session one and come back. I think there's something to be said for that, to where like I don't know if I would give me a second shot. And that is the what would you say? I guess that's like the critical self-talk, where I truly believed I was just the biggest piece of shit. And that, like, it's not cool for the process. It's not cool for the clients, especially if you have others on the day. That can totally kill the mojo for everyone, especially in the sense that, as they say in school, you kind of want to leave your shit at the door, so you can be like totally present for your client and the issue that they have. However, if you take a big L like that earlier in the day, it's going to be tough to think like that you're going to be able to help the next person that you see, because you just like didn't. So you get the weird feelings of imposter syndrome and like, do I even know what the fuck I'm doing? And just thinking all the worst things. And that shouldn't be the way that you want to go about things, because at the end of the day, you're giving power to somebody else. If you're gonna like feel that way about ultimately not a negative interaction, right? We learned so much from it, but in the moment, yeah, it was pretty rough. Anyway, so that's just a mini lesson on how to take an L, I guess. But yeah, the problem of the athlete is one that I will not treat lightly the next time, and will have another weapon in my belt to go up against that problem in the future. And like I said, with the second case that was presented in the same kind of vein, I was able to hit much better at what I think the goals were for the session. But that session itself had a particular set of circumstances that like concern me and make me wonder if I didn't just do a poor job. Even though I did better than I would have done not seeing the flash. However, one still wonders if you did good enough. Nothing afterwards, no review, and the chat after the massage was sparse, and maybe that's a self-conscious thing. You just did a service for somebody. They're free to go whenever. They don't have to sit there and talk to you. Even if you feel like you want to give them a little information, talk about stretch it, what went right, what went wrong. Even if you want to have that conversation, it doesn't mean they do, and that's okay. That's like super okay. But it all factors in when you're doing the post massage debrief, right? So I guess what did I want to get out of this chat, out of this rumination on the problem of the athlete, is just be very wary of the steel cables, man, because they are tough to work on. They are worked in a way that the therapist has to match, and like I wasn't able to, and that created a big issue in the moment. So I guess think carefully, and this is the lesson that came out of it for me, is think carefully about your clients and who they are and what their issue is, and the individual differences in between everybody, because it was the putting of these individuals and my own practice into tiny boxes to where I could not see that they were something else and they needed a different treatment, not to a degree that caused butting of heads, but definitely was not how I want every first session to go. So in the future, I will think about being more open-minded, thinking more holistically about issues instead of just being so narrow-minded on just like what I've seen before and what I've done before. And as always, there's the theme of trying to ask really good questions, maybe too many questions. Ask the same question over and over. I know with some of my clients that have more of a long-standing issue, I've asked about how it happened multiple times. I just ask things in the hopes that I'll be presented with like a novel bit of information that I didn't have before, that is in some way more of a key to the problem than if I didn't have that bit of information, right? And I think in there is a small, maybe a little bit of a nugget of another topic that I eventually want to get into, which is this idea of like false positives in massage, where as you work along chronic issues and find the lines of tension and the things that are going wrong, there's something that happens where you're right a bunch, but each of those individual right answers is overall the wrong answer. So it's like the right answer on the path to the final thing that's like, oh, it was the blah, blah. But like along that line, you're like, oh, well, let's work in this way and stretch this out, because I think like, oh, this muscle or this thing, this motion might be like the key to what's going on. You loosen that up, and then you find out like, oh, well, yeah, now it's like a little further up the arm, or it's less here but now more here. And that can be like really frustrating for a client, where it's like, yeah, but now it's like over here, this feels better, but I still have to see you because now. So working through all of that can be like very, very difficult. So I think moving forward, that's a topic of conversation that I would like to get into, and maybe I'll be able to pull some like concrete data and clients that I can illustrate that point. But I think that's going to be all for today. I just wanted to talk about the problem with thinking you always will know the right answer, because you don't know what you don't know. And this was like a big moment of being presented with that for me. So I enjoyed working through that out loud. I just wanted to thank you for listening. Hopefully this was helpful. Hopefully you can apply some of this or something of this to your practice or anything that you're doing. Be aware, man. Keep your eyes open and ask good questions. And a lot of times that is a big part of the battle. So I just want to thank anybody who's listening. Again, this has been the Push and Pull podcast. I'm your host, Justin. Like, subscribe, leave a comment. Let me know what you think. Let me know what kind of problems you've been having in your own practice recently. But again, like I said, I just want to thank everybody for spending your time here with me today. And we'll see you next time. Thanks, everyone.